Good morning. I'm here on Treaty 7 territory as well as the Métis Region 3. I'm Sarah Hoffman, and I'm running to be the next leader of the Alberta NDP and the next Premier of Alberta. I'm excited today to share some of my healthcare policies under my leadership. I first want to thank Dr. John Meddings for agreeing to serve as a policy chair for health and for joining us today. Dr. Meddings is the former Dean of the Cummings School of Medicine here at the University of Calgary, as well as the former chair of the University of Alberta Department of Medicine. I want to thank him for working with members of the medical community and providing his expertise to this plan. Talking to experts should be a no-brainer when it comes to policy making. Unfortunately, it's no longer the case with the UCP government. Rest assured, a Sarah Hoffman NDP government will be talking to experts across Alberta so that we can develop the best evidence-based solutions. That was my track record as health minister, and it will be my track record as the next premier. My healthcare plan takes bold action to address our province's healthcare crisis. Since 2019, I've heard from countless Albertans concerned about our healthcare system. Too many Albertans don't have a family doctor. We are below the national average for acute care beds in our hospitals. More seniors are unable to age in their homes, and there are not enough care beds for those who need them. The list goes on. For 5 years, the UCP has failed Albertans when it comes to healthcare. That's because they only care about ideology. They want to privatize as much of our healthcare system as they can. I always have hope that we can stop the UCP's chaos because I know that Albertans don't share those values. It was New Democrats who built Canada's public healthcare system, and it will be New Democrats who fix it here in Alberta. So let's get into specifics. I will train and recruit 1,000 doctors to address our current shortfall, and we all know that more Albertans are coming too. This is ambitious, and it's going to take time. That's why in the short term, I will create and expand primary care teams by recruiting up to 3,000 nurse practitioners, physician assistants, and clinical assistants. This will allow existing primary care physicians to treat more patients, and it will provide the time that we need to train and recruit more doctors. How will we recruit these healthcare workers? Well, we will work with the experts. When I was health minister, there was a task force that brought together government, the medical community, and our universities to ensure that we had a plan to attract the healthcare workers that we needed. The UCP got rid of it, but I'm going to bring it back. My healthcare workforce planning and implementation group will provide recommendations regarding future workforce needs and infrastructure requirements to support the new staff. I will examine population and demographic shifts to make the necessary plans so that we have access to the healthcare workers we need. Part of my plan to recruit doctors involves creating more rural healthcare training opportunities. So that means expanding our medical schools in Calgary and Edmonton to Lethbridge and Grand Prairie. And I need to give credit where it's due. The UCP has actually started some of this work. However, only New Democrats will do this quicker and to the scale that we need, especially in family medicine. I also want to attract Canadian medical students who are studying abroad and expanding postgraduate opportunities for them here in Alberta. These students already want to practice in Alberta, so let's make it easier for them to do that. And there are many new Albertans who have healthcare training from a country of origin other than here. So I will expand bridging programs and work with post-secondaries to prioritize Alberta residents for these spaces. We also need to examine physician pay and transition away from a fee-for-service dominated system. We can adopt the same payment model that British Columbia has, which encourages doctors to transition from a salary model so that they can take on more complex patients. Many Alberta doctors have left for BC since the UCP was elected, and we need to bring them back. This raises a critical point. Any good recruitment strategy needs a retention strategy. And that's why I pledged to stop the UCP's attack on healthcare workers. Healthcare workers from across the province deserve support from their elected officials. I will create an environment that celebrates healthcare workers, and I will do that as leader of the opposition and then as premier. We also need more hospitals and more acute care beds. Alberta is below the national average, and the UCP is only making the problem worse when they delay critical infrastructure projects like the new South Edmonton Hospital, the expansion to the Red Deer Hospital, and many others. Under the guidance of the Healthcare Workforce Planning and Implementation Group, we are going to get these hospitals built. And we will continue to expand the healthcare infrastructure as our population grows. I will also extend operating room hours by increasing nursing hours and inpatient beds in existing AHS spaces. This is a long-term process that would start with extending weekday operating room hours and adding Saturdays. As capacity grows, these hours will be extended. Like in primary care, my plan will expand the use of nurse practitioners, physician assistants, and clinical assistants so that specialists can see more patients. I will also work with Alberta's medical schools so that we can expand training opportunities and recruit more specialists, and particularly anesthesiologists. To ensure that Albertans with the highest needs get seen more quickly, I will also incent a central triage system. To free up more acute care beds, we need to provide better services to seniors in the healthcare system. That means investing in home care and continuing care. My plan will build at least 1,500 public and nonprofit continuing care beds, and it will take the pressure off the acute care system of our hospitals, as well as taking pressure off family members who are caring for someone at home who's on a wait list. I will also invest in more elderly community support and home care so that more seniors can stay safely in their current homes. I want staff at long-term care facilities to see my government as a partner. Staff who care for our most vulnerable shouldn't have to stress about going to the food bank or how they're going to pay for their child's birthday party. That's why my plan will ensure that staff who work in these facilities earn a living wage. And I will set appropriate staffing ratios and a minimum number of hours for care for patients. Before I turn the podium to Dr. Meddings, I want to address NDP members. Serving as your Minister of Health was a huge honor. I was so proud of what Rachel and I were able to accomplish, but it was just the start. I'm ready to finish the job as your leader and your premier. I know that there's a lot in this plan, and that's because I've listened to what you've told me. Members told me that they wanted more big, bold ideas in the last provincial election. Albertans are demanding that we fix healthcare, they share our values, and they're looking to our party for solutions. My plan is rooted in NDP values, and it will give them something for Albertans to vote for in the next provincial election. In the weeks to come, I'll have more exciting healthcare announcements. Healthcare is key to why I'm in the NDP, and it's the cornerstone to my 2027 platform. And it will be why Albertans elect us to form the next government. With that, I want to invite Dr. Meddings to the podium.
So I would like, first of all, to say good morning to everybody. And secondly, I'd like to thank Sarah Hoffman. Several weeks ago, I had a meeting with Sarah, and she asked whether I would convene and chair a small group of experts to come up with a series of health policies that would benefit Albertans. And I have to tell you how novel that felt, to have a political leader in this province, Alberta, ask completely honestly for expert opinion on how to help. How novel is that? Something I've missed, and I want to thank you, Sarah, very much from the bottom of my heart for demonstrating that kind of leadership. Secondly, I'd like to thank my co-chair in this endeavor, and that's Dr. Braden Mans, and a group of experts, health experts from across the province. We've met on several occasions to come up with a consensus on what is wrong with healthcare and what we thought the best plan forward was. And that's described in the healthcare policy that we provided to Sarah. Importantly, both we and Sarah have agreed that this is not a proprietary plan. It's in fact a common sense approach to the problems that Albertans all face, and we're more than happy to share this with others who ask for our help. So what's in the plan? Well, there's a lot of information in the plan that we provided, and it's focused at a very high level on providing a broad description of what is wrong, what we could do to fix it. The specifics of exactly how they would be fixed would depend upon the environment that was present at the time the plan was implemented, 2027. So we have to wait a few years for that. But a few specifics that are in the plan. What's the biggest problem with Alberta health? I think if you ask Albertans, Alberta physicians, Alberta patients, anyone, they'll tell you the health care I got was great when I could get it, but I can't get a family doctor. I have to wait 4 years to have my hips done. And I'm sorry, that is unacceptable. People cannot access health care in Alberta in a timely fashion. And the reason for that is a lack of resources, people and spaces. Not enough healthcare workers, not enough acute care beds. And the reason is that the province has failed to plan for the demographic changes that have taken place over the last several decades. It's not as if this wasn't unexpected. We've been able to see demographic changes for years. We just haven't planned for it. So that lack of planning must change. Across our entire system, what we need is a workforce planning and implementation group to start planning with the people that we're going to need and the physical infrastructure that they're going to use to set us up for decades in the future. We used to have such a group within the Alberta government. It was tightly linked to Alberta Health Services and to the training universities. It looked at planning down to the level of postal codes and out 10 years in the future, what we expected to change. How many healthcare individuals each area needed, how many hospital beds they needed. Unfortunately, that group was disbanded by the UCP. Sarah would like to bring it back, and I think that is a wonderful first step. So what about some specifics? Well, the first thing that any emergency physician would tell you when a patient from a car accident came to the emergency room, stop the bleeding. We don't have enough healthcare providers right now, and we are bleeding healthcare providers to other provinces. So we need to stop that. And whether by recruitment or by training, we need to rebuild that healthcare expertise. That is going to take time. And so during that time, while we're doing that, we need to expand the ability of our existing healthcare providers to see more patients, to do more for us. So, number one, to adopt a primary care physician payment model that is similar and is in fact competitive to the British Columbia longitudinal funding plan, not to replace, but to complement our existing fee-for-service model. We need to bring back the physicians that we have lost. Secondly, we need to expand our medical schools and, most importantly, further expand the new rural training programs in Lethbridge and Grand Prairie. And thirdly, we need to expand the family medicine training programs for Canadians studying abroad. What many people don't know is that more people leave Canada to study medicine than actually study medicine in Canada. And there are many barriers for those individuals to come back. But in fact, we can remove some of those barriers for those individuals who wish to practice family medicine in Alberta by providing postgraduate training spots for them. We will create those under this plan. Next is the ability to expand the capacity of our current primary care physicians to see more patients. And the way to do this is by creating, fostering, and funding primary care teams in every corner of the province. With the funded support of nurse practitioners, physician assistants, and perhaps clinical assistants, our primary care physicians are going to be able to safely, more enjoyably, see more patients. They just can't do that without our help. So those teams in every corner of the province will allow all Albertans to be able to be rostered to a primary care team, just as their children are rostered into our school system. Next, we need more hospital beds for surgery, shorten our waiting lists, and to unclog our very overloaded emergency rooms. Canada, compared to OECD standards, has very few acute care beds. Canada has 2.6 acute care beds per 1,000 patients. Alberta actually pulls the average down. We have 1.8 beds per 1,000. And this is something that we simply have to change. So under the study and recommendations of the Workforce Planning Group, we need to start once again to build new hospitals, but we need to put them in appropriate locations where we will get the best bang for our buck. We need to start planning. How are we going to find the healthcare workers to staff those hospitals? Mm-hmm. But what do we do about the present? It's going to take a while to build hospitals. Well, about 20% of our acute care beds are actually not filled by patients who need acute care. They're filled by patients who are waiting and wanting to move out of the hospital into an appropriate continuing care facility. If we could simply reclaim those beds for acute care, it would be a very good start. So, number one, we will build about 1,500 publicly funded continuing care beds as quickly as possible. In the short term, we will explore space that could perhaps be safely converted into appropriate continuing care beds, not motels, appropriate space. We will invest in community care and elder support so that our seniors can remain living in space where they would like to be for longer. And this will gradually open acute care beds. Those can then be used to expand access to surgical wait lists, and expanding ORs will gradually open hours as beds and healthcare worker availability expands, and we can begin to start decreasing the terrible wait lists that we have for surgical procedures. This and much more is included in the plan, is intended to put Alberta back on the right track, a track that will lead to healthcare access for all in reasonable time frames, a system that we, once again, can be proud of, a system that I believe would be an undeniable Alberta advantage. Thank you.
Thank you, Dr. Meddings, and thank you all. I'm so proud of this plan and the expert opinions and research that brought it together. And if you are too, I hope you'll visit sarahhoffman.ca and get involved.